We are live.
Wow.
These are nights you don't come again. It's been a long time where you never come home. Really long, I do wonder. Papa, mommy, begin on the wonder. Really long, them the wonder. My brother, now where you day? When you go come back home, my sister, now where you day? When you go come back home, you see what the music you can say you like them come back. You can dance to the rhythm while people ain't get to come back. Like to be football, be into the football, be we know it. We want to better you that. We want it. We want to better you that. Dreaming big for tomorrow. We gotta walk hand in glove. Be an inspiration to the younger generation. Oh, yeah. I is because you back home. Oh, I'm in la vie. Yeah. My brother, where you day? When you come back home? When you come back, when you come back? My sister, where you day? When you come back home? When you come back? You feel like the music, you feel to me like I'm come back. If you dance to the rhythm, what people they get for come back. Tragedy, football, be into the football, be we want it. We want to get you there. We want it. We want to get you there. We want it. Yeah. Oh, sweet, oh, the returnees. Miranda OBEN, calling you back home. Official, Zing tonight, you already know.
So, hello. Everyone out there, hello. It's a beautiful new day. We want a better new day. We are kind of been now in weeks and weeks of the lockdown because of the coronavirus. We started by showing you which guests we've had on the program the past week. We want to thank the brilliant team which is working behind the scenes to set all this up. And we, of course, also want to thank the amazing people making sure that everything is running smoothly. We're just listening to some music while waiting for guests to connect, and then we will start, right? So we'll just wait for some more guests to log on, connect, and then we'll carry on with the interview.
See tonight, you don't come again. It's been a long time where you never come home. You know, I do. Papa, mommy, begin on the wonder. Really know, them the wonder. My brother, now where you day? My sister, now where you day? When you come back home. If you see all the music, you can say you like them. Come back. If you dance to the music, what people they get for come back.
So, ladies and gentlemen, hello and good evening. This is Miranda. You know, and it's 7 p.m. in Germany, 6 p.m. in Cameroon, and every day we connect to talk to different guests from different parts of the world. And it's a huge pleasure for me to welcome a young and brilliant Cameroonian my team and I of the Returnees project discovered last year in Cameroon. Very proud of the work she does with her co-founder and a wonderful team in Cameroon. I say hello to Raul, the co-founder, and all the members of the team. We have had, like you watched at the beginning, very, very interesting people here with us every 7 p.m. We've been in Boya talking to Agbobala. We've been in Douala talking to Dr. Ken Stevens, Yaoundé talking to Christian Gang. We've been in Canada. We've been in Luxembourg, the UK, the USA, France, Germany, all over the world. Today, we're welcoming with me the founder, and she has a co-founder, Raul, of the Quality Healthcare Clinic in Cameroon. She's also the winner of the Returnees Young Entrepreneur Cash Prize last December. So it is a pleasure for me to welcome you now here, Tanekeu Durance. Hello and welcome.
Hello. Thank you so much, Miranda. It's a pleasure being here with you. This is actually my first Facebook live session. So I'm really excited about it.
So we're bringing.
And hello.
Go ahead.
Hello to everyone who is following us. I'm happy that you're connected. And I hope that you get the best out of this session.
Great, great, great. I'm happy you've actually had your first ever Facebook Live with me, just like the other day with Bate. We've realized actually there are so many hidden talents hidden behind the scenes, right? So we try to bring them out so people can discover them. I would like my diaspora to discover you and the brilliant work you do in Cameroon. Good afternoon from Luxembourg. That is Gilles Com. He says good afternoon all.
Good afternoon, Mr. Gilles.
Right. And then we also have Raul Bonge Fokwa, your co-founder, who says hello, Miranda. Hello, Raul. I hope you're all watching, and I hope that the diaspora watches this tonight or later on to see, the work you do out there in Cameroon, right? So, but to start with, before we get to the depth of our interview, just tell us, who is Tanekeu Durance? Who are you? What do you do? Just a little bit about yourself.
Tanekeu Durance. By profession, I'm a nurse. I'm a trained nurse. And well, by passion, I'm a volunteer. Yes. So volunteering is a passion for me. I love doing things. I love doing things that I feel that for the benefit of community. It's a passion for me. And I'm from the west region of Cameroon, from a family, from a very big family, a family of 7. And I'm saying hello to my mom and dad and my siblings. And in addition to that, I am an alumni of Sea Life, the Sea Life 7 Leadership Fellowship. And I'm also a fellow, a fellow of the Obama Foundation Africa Leaders Program that I undertook in 2019, in July 2019. I'm equally an alumni of the Cameroon Leadership Academy, headed by Mr. Roland Quemen. And basically, yes, I love cooking and I love smiling. Basically, yes.
Are you based in which part of Cameroon are you based in?
I'm based in Yaoundé. Born and bred in Bamenda, and recently, 3 years back, I moved to Yaoundé.
Good reasons to take you to Yaoundé. But before we get into the depth of the discussion about quality healthcare clinic, etc., could you just tell us a little bit, is there a difference at all between a clinic, a mobile clinic, hospital care center? Just give us an idea of what to understand as a clinic or a hospital.
There is a difference between a hospital, a clinic, a health center. So the hospital is actually a bigger structure. So the hospital, you have the different specialists, you have more hospital beds where patients can be hospitalized, you have inpatient care. So it's a whole big structure with a lot of specialist care. Then the clinic, normally the clinic is supposed to, the clinic is just a health facility where we offer mainly outpatient care. So for the clinic, people are supposed to just come in and they are not hospitalized at the clinic. But that is not being observed in most cases. And also we have very big structures that have grown into hospitals. They started as clinics, they have grown into hospitals, but they still maintain their names as clinics. Like we have the Mayo Clinic, which is the Mayo Clinic is actually a hospital.
Right.
And then for a health center, the health center basically it serves people in the rural communities. So the health center the health center is the first point of contact in the healthcare system. So that's where people in the rural communities, they are supposed to, when they have minor health issues, they are supposed to go to the health center, and from the health center they could be referred to the district. From the district they are now referred to the tertiary hospitals. Then for a health unit is just a structure that is established in an area to serve a particular need. For instance, we can have people who are giving vaccines to children in a village, for instance. There could be an area that is not so accessible for the health team. So they can decide to have a health unit in a certain area in that community, which can facilitate the access for people to carry out that particular service like vaccination. We could also have a unit like for diabetes, we could have a unit for HIV. So the health unit serves for a particular purpose. It could be for preventive health services specifically. And then for the mobile clinic, basically they are buses that are being transformed, vehicles that are being transformed to serve as clinics. So they go out to meet people right at their homes, they go to communities, and they could be both in the local regions and even in the urban areas. So basically that's the difference.
Right. And what would you say the quality healthcare clinic is then? Under what category does it fall, and why?
Quality healthcare clinic, it's going to be in the it's going to be in the category of a clinic, because at the moment we offer mainly the outpatient services. Yeah, though we plan on offering the inpatient, the outpatient and the inpatient services, but at the moment we don't work 24 hours on 7, so we have that status of a clinic. So even as we receive the patients, they go back to their homes at the end of the day.
Okay, so effectively the name clinic falls under the category of clinic because some naming is different, right, from the real structure under which it falls, right? But yours is
exactly.
it's effectively a clinic. So tell us a little bit more about a quality healthcare clinic. What is a day like at your unit? Tell us a little bit more about it.
Well, quality healthcare clinic, we are actually a health facility. Our main aim is offering people primary health care with excellence in service, in quality, and in access. So a typical day at quality healthcare clinic, we have patients who come in for wellness consultations. A wellness consultation is that what we are giving to the community as a free service we are offering to the community. So we give everybody the opportunity to come to the hospital to get health information. So whether you're sick or you're well, everybody, we give you that opportunity to come to the hospital. So we want to keep people closer. We want them to have that information about the disease that could be affecting them, or we want to attend to those questions. We want to answer those questions which they have, but probably they could be getting the wrong answers from the people who are not in the field. Then we have people who are coming in for ill health consultations, where they can go through a laboratory test, they go through the consultation, they go through laboratory test, and they receive their treatment. So we equally thank you, Mr. Driver. We equally have those patients who are those patients whom we refer to other hospitals for proper follow-up. So basically, that's what we have at Quality Healthcare.
And what is your driving force? Like, what got you to creating this? What made you set up the QHC, and what motivated you?
Quality Healthcare Clinic, we started 3 years ago, and that was when we moved here to Yaoundé, my co-founder and I, because we went to the same nursing school in Bamenda. So when we finished from there, we came to Yaoundé to do a degree program, a first degree program. And so in the course of that, we got a part-time job in a company. So we were working as supervisors for the Africa Cardiac Care Project. And in that project, we were supervising about 7 district hospitals in the region.
Mm-hmm.
So every day in these hospitals, we realized that the care that was given to patients, it was not what we wanted. We felt that patients needed more. And we realized that if somebody doesn't have enough money, then they won't be able to access that kind of care that they desire. And that for us was like, no, it's not supposed to be like that. Everybody is supposed to be treated equally, irrespective of whether they have the finances or they don't have it. So with that, at that time we were still students, so we're not able to set up the clinic. We thought about setting up the clinic, but the means, it was difficult, and at the same time we were working. So what we started doing, we were printing flyers, and on weekends when we were not working or going to school, we were going from door to door to sensitize people, to give them health education. Then some few months later, we got a room. That's where we started the clinic. So in that room, we had just one bed, we had a table, and we had a blood pressure machine. That was all we had, nothing more. So as the days were going by, and it was in a student area, we recruited 2 nurses since we were going for work and going to school at the same time. So we could not manage that clinic and do all those things at the same time. Mm-hmm. So we recruited the 2 nurses, and as the days were going by, it was tough because being a student area, the income as well was not. We were rarely having any finances coming from the clinic. Most of those who were coming, the services that were being rendered were not being paid. And also we felt that need, like this vision that we have, we are the ones supposed to be behind it. If we want to start something like this, we ourselves must put in what we are thinking about, what we want to install. We too must be there to see that it goes through properly. So we had to quit our jobs. And also, given that the salary, the money we were using to pay the nurses, it was our own salary from the job that we had. So we had to quit our jobs to come and start working at the clinic. Then we started working, and yes, as time went on, we continued with the community sensitization. And we had more people started coming. Then a year later, we moved into a bigger place.
Okay. Yeah. So a year later, you moved into a bigger place. It's been steps along the way. But what would you say are or were the challenges you faced with the QHC? Think about when you started, the challenges you had at the time, and then now currently, what are the challenges you have along the line?
When we started QSC, we had the problem of managing the three things we had to do at the same time: the school, the work, and equally managing the clinic. So it was difficult. Then also our parents, our parents could not understand how we could quit the jobs that we had to start to be working in a clinic which practically did not exist, because nobody in the family actually believed in what we were doing. I remember my dad one day, when I called him to tell him I was really broke, my dad told me to pack my things and come back home because he doesn't know what I was doing in Yaoundé. So it took us practically a year and 6 months for us to get our families to understand what we were doing. And now our families would actually do everything, anything for our clinic, because they've come to understand what we are working for. Then during that was before the clinic. So after that, when now that we are running the, the clinic, the challenges that we are actually having, we have management challenges, since we are not entrepreneurship is not something that we studied at school. So we are actually learning on the go. So you have to fall every time to be able to rise again. It's an everyday thing. We are learning how to cope with everything. And equally, we have the financial challenges that come with entrepreneurship and all that. So as time is going on, we are learning how to cope with all this.
And what are your patients saying? Are they giving positive feedback about the work? And what are your patients saying?
Exactly. The positive feedback from our patients, that is one of the things that really keep us going at quality healthcare, because almost like twice in the same week we have a number of patients who come in saying, I was referred by this particular person and they told me that here you guys work so well, and that is why I came. And when they come, themselves, they verbalize, they are satisfied with the quality of care that we have. So basically, most of the patients that we are having, it's from word of mouth referrals, and also the free wellness consultations that we offer. From the start, people did not really believe when we went to the community to sensitize, to tell them about our services. They never really believed that a clinic could offer a service for free. When we tell them, oh, if you come to our clinic, we are going to give you health advice for free, we are going to take your BP for free, we take your weight for free and all that, they were like, no, that cannot be in Yaoundé. So when they come to the clinic and we do all those things for free, yes, to them it's a surprise, and they go and they tell others, and that is how people get to know more about us.
Right. So now they get to know by word of mouth and positive feedback. Is there anywhere online, without me having to meet these people out there, can I read some of this feedback with the name? For example, this is what Ruth said about the clinic, or John or Peter or so. Is there anywhere online where I can just read, like, testimonials?
Oh no, for now we haven't been documenting those testimonials. So we are going to actually start doing that, because for us, we as health professionals, we are not really, though it's something that is getting into the trend, but for us, privacy is actually something that we keep a lot. So, well, with the consent of these patients, henceforth, we are going to document their
Right.
testimonials.
Very good. With the consent of the patient, you can document the testimonials and you don't need to write the last name, right? If there is a patient
Right.
which is Mira and then the last name, you could just put Mira and then O. Nobody ever knows. Or you just write Mira, because Mira effectively said that. Yes, with their consent, you can write their full names. Without their consent, you will not be able to publish, but it will be an idea. I'll tell you, the Airbnb, which is a way of renting. Like if I left now and went to Italy for a week, I can rent like an apartment before coming back again. And their success came from referrals, testimonials, because when they hear that people have said that, and you know, a lot of things are getting now online, right? With everything that's
Yeah.
happening, very digital. So it'll be good, just as an idea, to have a platform where we can actually go and read what these people have said with their consent and using maybe just their first name. That will be very helpful, okay? Just as something you can take
Okay.
with you. Now, tell us about the
Exactly.
QHC before the crisis and during the crisis, and maybe what you foresee for the future.
Okay. QHC before the crisis, we had our day-to-day life like normal, and we were receiving everyday patients. So we were receiving patients on a daily basis without any fear of being at risk for death or for contracting the coronavirus, or
Right.
our family members calling us to tell us to shut down the clinic and go back home. Yes. So before the crisis, we had actually a normal day-to-day life, like every running clinic. So now during the clinic, QHC, we are actually facing a number of challenges with the crisis, because firstly, there are patients who are, many people are scared of going to hospitals
Mm-hmm, mm-hmm.
because they fear being infected, and
Right.
others also fear being declared positive for the virus.
Mm-hmm.
So many people are skeptical about going to the clinic. And also, the patient turnover at the clinic has really gone down. Then before the clinic, we used to do home care services, but now we cannot do that for the safety of the patient and for our own safety too, because we do not know if we ourselves we are infected,
Right.
since we are in contact with patients daily.
Mm-hmm.
So for the safety of those people, for the moment, we don't do that. And then Quality Healthcare Clinic, in partnership with Local Youth Corner and some other organizations, we are actually working on the production of hand sanitizers, for free hand sanitizers to distribute to the communities for free. So far we have produced over 10,000 free bottles of hand sanitizers that have been given out to the community. So in the days ahead, we are going to be offering free hand sanitizers to the people that we serve around the Commercial community. So presently, what we have done in that area is just sensitization. So we've just gone door to door. That was before the lockdown started. So at that moment, movement was still free, because for now, we are no longer going door to door to do that sensitization. So in the beginning, we went out and we did sensitization on about the virus. So in the
Mm-hmm.
days ahead, we are going to be offering them sanitizers.
Great. And what do you foresee for after the crisis?
For after the crisis, well, also there's one thing which I didn't mention.
Okay.
We are having new patients during this crisis. We have actually received a number of new patients who were being treated at the tertiary hospitals. So the big hospitals, those patients have now decided to come to us, because they believe that we have not been in contact with those patients with COVID, or the COVID patients would not come to us. So they have now come to us for their follow-up. So what we plan after the crisis is to maintain these patients. So we have to ensure that the services that we are offering will continue to suit them, so that even as the crisis is over, we are going to keep them with us. And then also we had projects which we had planned. Those
Mm-hmm.
projects, the projects we had planned, they would not change much, though there is going to be a change in the project. They would not change much, but we are still going to work on them.
Right. So keep
Mhm.
on working on your projects. They won't change much. You just probably shape them again to the future. Think always about the digital, right? Face to face communication is great, but with the pandemic, it's shown us that we need to be online with most of our services, etc. But what measures have you put in place at the clinic for the patient who comes in through the door today? What measures are put in place to limit the infection rate within the quality healthcare clinic during the pandemic?
Okay, at Quality Healthcare Clinic, firstly, the staff wearing the personal protective equipment for the staff, it's mandatory. So at all times, the staff need to have their mask on. Receiving a patient, you maintain the distance, wearing the appropriate clothing and the right shoes.
Mhm.
Then at the entrance, we have a flowing tap. We have the tap, we have soap.
Mhm.
So when a patient enters, immediately they wash their hands. When they wash their hands at the door, they are served hand sanitizer. So they use in
Right.
sanitizing their hands. And then they go into the consultation room where a distance is maintained between the health professional and the patient. So throughout the consultation, we ensure that the safety of the patient is being put into priority. Mhm.
Okay, so the safety of the patient is put a priority as a priority. You have all those hand sanitizers. You're offering some. You've made some which you'll be offering to the population and so on. You know, in general, even
Yeah.
without the crisis, some people don't like having to stay in hospital. Just being in hospital makes them even feel worse than they already are. Do you carry out home consultations and taking care of the patients at home?
Actually, before the crisis, we were offering home consultations, but now we cannot we cannot do that because given that the virus, we are health personnel and we are in contact with patients every day. We don't know if we ourselves are safe. So in order to avoid putting these patients in danger or putting their families in danger, we prefer to limit our services now to the clinic. So for the moment, we don't do home services. What we do is that the patients that we follow, they have our phone numbers. Those who can call us, those who reach out to us, they reach out to us on phone. So they tell us, okay, I have this problem, I have this problem, and I have this problem. Because there are also many people who are worried that they are suffering from this virus when most of the times it's just a psychological issue. So
Mhm.
sometimes when we talk on phone, these patients, they end up coming to the hospital or they just stay at home and we tell them what to do at home. So for now, we
Right.
don't go to people to patients' houses anymore.
Right. So you prefer to, just work remotely or limit the number of patients you have to go to. But if somebody called you and had symptoms or displayed or mentioned symptoms of the COVID-19, what do you do as a clinic? What do you do then with such a phone call?
As a clinic, if somebody calls us and has symptoms of COVID, we are going to refer them. So we refer them to the centers that are managing these cases because we are not equipped. We are not equipped to manage such patients. So we refer them to the right hospitals where they can be better taken care of.
Right. I heard that as well with the polyclinic in Yaoundé near the Palais de Congrès, that clinics are not allowed to hospitalize COVID-19 patients. So it goes in line with what you have just said. Now, when I look at health, right, it's very indispensable to all, but this is a sector in which very few people invest, the health sector, at least speaking from the results my team sent through from Cameroon. You recently won the Returnees 2019 Cash Prize Award. Would you tell us a little bit how it was winning this award?
Well, Miranda, actually, I'd want to thank you and the entire team for giving us that opportunity. It was really Well, it was incredible being able to win that award. Well, I would say that was the very first time I had to pitch my project before that kind of an audience. So that prize, it was, as we said, as we pitched on that day, the prize was intended to be invested in the maternity section of our clinic as we plan to set up a maternity. So we had 200,000, and 200,000 was good money. So we could not, it was good, but it could not alone open a clinic. So we used it to start the prenatal section of the maternity. So we used it to buy basic equipment that we are offering prenatal care to pregnant women. And at the moment, up to 13 women, because of thanks to that prize, up to 13 women have been able to receive prenatal care services at Quality Healthcare Clinic.
Great, great, great. That's amazing. We need to see the names of all those babies so we can call them all returnees babies. But that's good. Congratulations. Congratulations. You know, if the money is taking care of new life, that is amazing. And I believe that your team, from what you said on that day, you were going to invest the money very, very well. So we're proud of you. We invite you and the team on the 18th of December 2020, 10 of you. So you have a table of 10. So you can come and exchange with the guests in Douala again. Tell us what you've done with the money, how far you've gone, you know, just present to us the results of having won that cash prize. It encourages other people to also invest from the diaspora, to invest in people back home and also see the impact, you know, you can bring in other people's lives. So congratulations on that, and extend.
Thank you so much.
Right, on behalf of my team, do kindly extend our warm regards to the entire, you know, team working in the natal section with the mothers or the babies or something like that. Extend our regards to them, because if we had sent out the money and you hadn't invested properly, right, we would not even be able to celebrate you today, right? But we didn't know how with that, and it's today for the first time during this interview that we're hearing how you invest the money. We see you there with the Ministry of External Relations, Patron Roland Kwemen, and then of course a guru in the entrepreneurship industry, Dr. Thierry Nyamen, and most of the award winners behind you there. So that is amazing to hear how well you invested the money. Now tell us, do you work, you mentioned some clinics or you work in collaboration with, do you also work with hospitals? I didn't quite catch that. Do you work in collaboration with hospitals?
Yes, we work in collaboration. Actually, healthcare is a collaboration. At the level where we are not able to manage all patients. So the patients whom we are not able to manage, we refer them to other hospitals where they can be better taken care of. Because you cannot, at the moment, we don't have the specialists to be able to take care of all patients that come our way. And even in hospitals, in hospitals where they have those specialists, there are still patients who come and they are not able to take care of them. So they have to be referred to other people.
Okay, so they have to refer to other people. But what do you envisage when you look at the Quality Healthcare Center today? What do you want it to be like in 5 or in 10 years? What is your plan? What's your big vision?
Our vision for quality healthcare, for our short-term goal is actually being able to have a maternity in place. Then 5 years from now, we are actually we envision having a 50-bed hospital. So 5 years from now, that's what we plan to do. And then our services in 10 years, we actually plan to extend our services to all the 10 regions. So we want that everybody in these regions should be able to access the quality of care that we are providing, irrespective of whether they have the finances or not. So those are the three things which we are working on.
Now, do you know about the quality, health, security, environment rules and regulations which are in place? Do you have any idea of that?
Yes, I do. Though I don't have in-depth knowledge on that. I do have an idea about it. And at the clinic, we try to maintain some of these rules for the safety of our patients and equally for the staff at the clinic.
Right. So do you think that if you had like this safety expert who could look at your facilities and give you more advice, would you be willing to work with someone like that?
Oh, certainly. With all pleasure, we are going to welcome them wholeheartedly.
Okay, because my team will be reaching out to you because one of the questions which we wanted to know is if you have the QHSE, which is the Quality Health Security Environment information, or you know what it's all about, and then also send someone who could work hand in hand with you just to check and ensure that as you're growing and getting better and better, you're also following the norms, right? You're also following
All
the
right.
norms, ensuring that everything is moving smoothly. So we will get someone in touch. A member of my team will get in touch with you because you want to look at not only nationally. So we're looking here at not only nationally, we want you to compete internationally as well. So it
Oh,
says here
sure.
you have to follow the compete nationally and of course also internationally. So I'll get someone to get in touch with you, of course, so that
Thank you so much for that.
no problem. But then as you speak, there are a lot of people who are sending you words of congratulations out there, which we don't want to miss. So we'll start here with Tiku Cynthia, who says, keep going, girl. Much love.
Thank you so much, Cynthia. Thank you, dear.
Lovely. And then we have also Ijab Eureka, who says, congratulations, Durance.
Oh, hello, Patra. Thank you so much.
Right. I also have a lot of comments coming through. Theophine Fenje, who says, I like your zeal, Durance.
Oh, Phil, thank you. Thank you.
Right. So we have Ernestine Muma, who says, congratulations, Durance. That's great, girl.
thank, thank you so much, Ernestine. Thank you.
We have Larinette C, who says, congrats, madame.
Oh, wow. Larinette, that's my student. Thank you so much.
Very good. And then we have Gilles Com again, who comes back with congratulations to you.
Sir, thank you very much. Thank you.
Right. And then you have here Foka Sherifatu, who says, congratulations on what you do, Durance. My first time getting to meet you. Thank you, ma'am, Miranda OBEN.
Oh, wow. Thank you so much, Sherifatu. I hope to meet you in person, actually.
Great, great. And then, of course, we have Divine Winter in Germany, who says she's an engineer in Germany. Oh, if you remember the Returnees magazine.
Oh, certainly I do. I remember her very well.
Very good. So she says, this young lady is amazing and very intelligent. The way she talks about her project, I can feel her dynamism and so much passion in her job. Keep going, girl. You make all of us so proud.
Oh, wow. We thank you. Thank you very much. Thank you. That's the same energy that you spilled at the returnees in December.
Right. So we all look forward to having you on December 18th at the Returnees event. But before we carry on with the interview, I'm going to ask you something which, oh, lovely. There's also someone commenting here who says, waiting to see the next moves. Thumbs up.
Oh, wow. Elise, hello. Thank you.
Elise, the vice president of the Returnees project, who says, waiting to see the next moves and says, thank you. Now I'm going to ask you a question which makes you think a little bit further. Imagine the Minister of Public Health is watching this interview. What would you like to ask him or tell him?
That's a tough one. But to the Minister of Public Health, well, the one thing I would like to tell him is that the people that the healthcare sector is serving, they are actually I don't know how to put it, but I want to say that these people, they need more than they are getting from the health system. So I'm going to plead with the Minister of Public Health that there is a lot of young talent that is out there in the health sector that we can benefit from their expertise to make our health sector to be the best. So to the Minister of Public Health, sir, please make use of these young experts. We have a lot of energy that we can put into the health system to make the Cameroon health system a very, very, very good one.
Right. So that message, you never know. Like I said, the last time we had the Ministry of External Relations following our work. Today we're addressing the Minister of Health. Now we'll go to another question, which is a little bit also tricky. Imagine you were the Minister of Health. What would you be doing during this pandemic? And what would you be doing after the pandemic?
Wow, wow. Okay, during this pandemic, firstly, I want to salute the efforts of the Minister of Public Health in Cameroon, Mr. Manauda Malachi, for all what he's doing to curb the crisis. If at the moment I was the Minister of Public Health, what I'm going to be doing is actually engaging everyone in this fight. I'm going to get everyone involved, especially the civil society organizations, because this is not a political debate, but the government officials, there's a lot of bureaucracy in the government. So I think that with the civil society organizations, there is more transparency and we could get things done faster. So as the Minister of Public Health, I'm going to be engaging every single person and using these civil society organizations to reach out to everyone, those right in the interior sectors. Because we cannot say that we are going to deploy personnel right into these areas. We have people who are already working in those regions that we could make use of them to be able to overcome this crisis. So I'm going to make use of the people in those regions. And also at the moment, not just the CSOs, we have a need for masks, for face masks and all those things. So like what is already happening, I'm going to be engaging engineers in the production of masks, and also I'm going to be training health personnel. That's was that I need to anticipate. I'm going to anticipate the progression of the illness, expecting that maybe in the days ahead, if we have more cases, how are we going to be handling it? So I'm going to engage, I'm going to train more personnel, because at the moment we have very few health facilities that are taking care of these patients. But what if we get to that point where we have 1,000 or 2,000 patients being detected on a single day? So I'm going to train more health facilities, more staff in various health facilities, not just the public ones, because there are some people that no matter what, they wouldn't even go to the public facilities. So try to identify some of those hospitals in the local communities where we could train the personnel there so that they can manage this crisis, or equally establish health units in these areas and train staff who are able to manage the crisis there.
Right.
And
now,
then,
okay, yeah, go ahead.
what would I like to say?
I was going to ask you more questions about equipment, though. You've talked about training personnel, but I'm thinking about medical equipment in general.
Exactly.
Maybe you want to highlight us a little bit about that.
Exactly. That's what I wanted to say. I wanted to talk about the medical equipment. So
right.
For the medical equipment, with respect to the medical equipment, in the country, we have engineers, we have tech experts, we have engineers from Polytechnic who are able to produce the equipment that we need. Recently, I saw on social media, there is a young guy who produced, a young Cameroonian who was able to produce ventilators. So I'm going to sort out all these talents since at the moment importing it is a challenge. So I'm going to sort out those talents and establish a laboratory or an industry where they could produce our own local equipment that could be used. Right. And then for the health personnel, ensure that the health personnel, they have the personal protective equipment that they need, and they are appropriately trained in infection prevention, because we have it's sad that in our country we don't have regular regular training for health professionals. Somebody can start working today as a nurse and works for 25 years, goes on retirement without ever taking a course to upgrade their skills. So I think that these nurses too, who are going to be managing these cases, we ensure that they are appropriately trained on infection prevention.
Right. Now, you mentioned already what you think about for your clinic in about 5 years. If you're thinking now further, long term, and you wanted to visualize in 20 years' time, let's go a bit further into the future. 30 years, what do you want to see? Of course, you'll not be 20 at that time, but what do you want to see in 20 years? What is your greater heights you want to reach at?
The greater heights that we'd want to reach is being able to train health staff who provide the services that we want. Because if we have a vision, that's something that has really been burning in me, because I believe that the people, the staff who would serve at Quality Health Clinic should be trained by us because we know what we want from them. So in the long run, I hope that there is going to be a school that is associated with the clinic, so that we are able to train those people and give them the values that we want for the patient at the clinic.
Perfect. Any tips and advice for young entrepreneurs?
For young entrepreneurs, actually, entrepreneurship is something that it's fulfilling when you're doing something that you really love, something that you're passionate about. But it comes with so many challenges. You'd go to bed crying, you would want to not smile, but you're forced to smile. You feel like the world is on your shoulders. But one thing I tell everyone is that you need to be consistent with what you do. If you believe in what you're doing, you have to stay consistent no matter the challenges that you're facing. Because definitely not everyone is going to accept what you do. People will not even understand what you're doing. But at one point in time, whether they like it or not, they're going to see and they're going to understand what you're doing. So just persist in what you're doing. Don't give up no matter how hard it is. It's true that sometimes we want to just shut down and then go away and have a peaceful life. But if you believe in what you're doing and you're really passionate about it, hold on to it and don't give up.
Don't give up. Hold on to it. If you believe in what you're doing and you're really passionate about it, hold on to it. So great advice for the young entrepreneurs. It's not going to be easy, but don't give up. People will not understand your dream and your vision, but guess what? That is why the dream is in your heart and not in their hearts.
Exactly.
Thank you very much. Now, you've been invited to the 5th edition of the Returnees event on December 18, 2020 in Douala. What would you like to present or display to the audience and the media present?
What would like to display to the audience is would like to show them what we've already been doing at the clinic. Would like to share the stories of our patients with them, and also would like to share our vision. Would like to share our future plans with them in detail, in greater details.
Great.
Yeah.
So we look forward to having you. My vice president is watching and is taking note of all that. I have said it's going to be 10 people from your team invited in December. So you get in touch with them at the appropriate time, get in touch and plan this out so you can present this. You'll also be meeting, I mentioned Dr. Kumbe, right?
Right? Well, so, yeah, I met him the last time.
Right. So he is into healthcare as well. He's an ophthalmologist who returned from Germany, and he has the eye clinic in Yaoundé. So he'll be in Douala with his team. So this is the collaborations we're bringing between mentors and mentees and putting you to work together so you can, get things moving better. So if you have he's coming there, and we're having a screening session, free screening session for all the patients who will register with eye problems. So they will be there with your team of 7 ophthalmologists on the spot, taking care of the people. We hope that things are better by then. Now, as we move on, would actually be our hope that the diaspora will watch more of this interview later on and reach out to you. That's our hope. But then, in what ways can the diaspora support you? What do you think?
The diaspora can support us with education. Over there, they are abroad, and they go to health facilities that are more advanced than in Cameroon where we are. The health system in which they are is more advanced, is more developed. So we would love to share in their experience. Would love to hear from them on how it's going over there, on how the services are rendered, on the technology that is being used over there. So all that is going to help us to better the services that we offer. And also, the diaspora can help us with materials, equipment. So like there in the US, for example, or in Germany, they have hospitals from time to time. They renew their equipment, and the equipment are not being used anymore. But if they come here, they're really going to be of use to us. And also the equipment that are produced there, they are way cheaper than what we can get here. So they can assist us with all that.
So education,
Mhm.
training, and equipment, right? So we'll be calling out on those in the diaspora who are watching this interview and who will watch later on. You can reach out to the Quality Healthcare Clinic, which is based in Yaoundé and run by Tanekeu Durance. She was the winner of the Returnees cash prize last December with her team in Douala. She actually received, is that Raul?
Exactly.
Very
He's
good.
the
So she received
one.
very good. She received her award with Raul, her co-founder in Douala last December, representing and having presented and pitched very, very well during the session in Douala, telling us about her vision and her mission and what she hopes to gain. And the jury listened very carefully. And of course, she's one of the award winners of the returnees last year. But this one was special because it was a cash prize, which would be invested into her quality, well, her health care, which also deals with a lot of quality. So anybody watching in the diaspora who wants to support in any way, reach out to Tanekeu Durance, based in Yaoundé. And like we said, right, we want to be an inspiration to the younger generation. So reach out to us and we'll get in touch with her and ensure that things move smoothly. Instead of us always running away from Cameroon for healthcare, if we took care of facilities like your own, this is talking to the diaspora, we would know that our parents are fine back home if they are in your hands, right? So that's
Exactly. Oh,
congratulations.
Miranda, there was something I forgot. Actually, I didn't answer the question on what I'd be doing as a minister after the COVID-19 crisis.
Okay. Mhm.
Uh, yes. So this point is very important to me. Now, healthcare is something that is not just a single aspect. It's not just about taking paracetamol that makes you healthy. So it's a whole lot of factors that make a healthy human. We have housing, we have food, we
Mhm.
have sanitation, and all those things. So now with the COVID-19 crisis, we are saying that water tanks are being installed everywhere in different places all over the communities. So
Okay.
I'd want to say that even after the crisis, this is what should be encouraged. These water tanks have to stay there. Those tanks should not disappear after the crisis, because it's not because there is no COVID that we have typhoid, we have cholera, we have other disease that we have as everyday challenge. And this disease are actually, they are really creating a lot of harm, even though the media is not talking so much about it like they are talking about the coronavirus. But there are so many things which we are really facing. And I believe that occasions like this, we need to continue with these initiatives that are being run. The civil society organizations that are offering hand sanitizers and face masks and all those things. We need them even after the crisis, because even tuberculosis, there is tuberculosis too. It's something that is killing people every day. And then housing, people need adequate housing. I think that if there was a means, we should provide housing for all citizens in Cameroon. It can be done. Because now with the COVID crisis, for instance, we have 17 people who are living in a single room. How do we expect them to maintain the social distancing which we are asking them to maintain? So it's really something that is tough. And if we overcome this crisis, how are we sure that tomorrow we are not going to be facing another crisis or the same crisis? So I think that after the crisis, we need to start, not even after the crisis, right now, we need to start thinking about tomorrow. We need to start taking the measures today in order to avoid the crisis that might hit us again tomorrow. We don't pray for that, but we need to get ready.
Right. So get ready is the key word there. Don't wait till it happens. And even after this pandemic, the COVID-19 crisis, there are other diseases in our communities which we have to take care of. And that also takes us a little bit into the Minister of Territorial Administration, your request for people to have adequate has facilities, homes, and so on. Of course, it takes the younger generation thinking out of the box, thinking far ahead to do all these things. So slowly but surely, with institutions like yours and your voices heard and the media passing on the message around the world or in Cameroon, things will keep changing bit by bit, one life at a time, one community at a time, one city and then one country. So keep doing what you do. And of course, we've retained that. If tomorrow you are the Minister of Public Health, you've already had an interview. You've already granted an interview. I have a question from Foka Sherifato. It's quite lengthy, so I'll take it in two sections. She says, my question is, I love her choice. So she loves your choice of words and it matches the reality. She can feel the passion in your words and the work you do with the healthcare. Now, to all of them watching, what does it take to groom a passion for a chosen profession? What does it take to groom a passion for a chosen profession?
Okay, grooming a passion for a chosen profession, actually. Well, to me, I believe that passion comes with values, the person that you are. So if you're that person who doesn't like to see people crying, if you're that person who doesn't like to see people hungry, what is your domain? What are you doing? Are you a dressmaker? If you're a dressmaker, maybe you don't like children being on the street with torn dresses. So how do you address that? I believe that with what you do, because passion is not just for the field in which you are. You can be in a field which you're not passionate about, but there is a particular thing in that field which touches you personally. And then you decide to address that. If you really feel for the people who are going through that pain, the people who are suffering from that particular challenge, then I believe that you'll be able to do anything for them.
Okay, another question comes. Go ahead.
Yeah, so it's just about identifying what you don't want to see, something that you want to make better.
Okay. Now, what message can you send out to healthcare givers who make it difficult for patients to overcome their ill health?
Well, for for healthcare givers who make it difficult for patients, well, I don't know if it's that they make it difficult or if it's that they don't treat you appropriately like you want. But what I'll say is that there's a number of factors that are associated with this. Maybe they are not satisfied with their jobs. Maybe they are burnt out. Maybe they are overstressed up by the work that they are doing and all those things. So to these healthcare professionals, I just want to say that if there is something that is stopping you from treating patients the way you're supposed to treat them, I just believe that you could take a vacation, you could take a holiday and give yourself time to take care of your own self, because you cannot give what you don't have. So you need to take care of your own self in order to take care of other people. So just give yourself that time. If you have realized it, just give yourself that time to take care of yourself. Then you come back to work and better take care of the patients.
So Nemon quote dot habit is an expression I saw somewhere, which means really you cannot give what you don't have. Something like Nemo quote non habit, like you can't give what you
Oh
don't have.
yeah.
And I've actually heard that. Yeah, I've actually heard that it's a legal rule which says it's actually got two phrasing. It's got Nemon that quote non habit and then Nemon quote dot habit. One of them is correct and the other. So when I check your Wikipedia, it says Nemon that quote non-habit. So that is the second time I'm hearing that in the day of today. I'll just send it for our viewers to have that displayed as well. And true, yes, if you have to take
Wow.
care of, you have to take care of yourself. Yeah, the person I interviewed before you, Dr. Pablo, said the same thing. You have to take care of yourself. If your job is stressing you up, make sure that you take the time out to rest, relax, or so on, so it doesn't affect you too much. Now let's talk about something else like books. Do you find time to read books, and which book can you recommend, and what music do you like?
Oh, sure. I find time to read books. I love reading. My dad taught me that. So my favorite book, which I recommend for everyone or every young entrepreneur to read, is The Motivational Speaker by SST Tilawan.
Okay,
Yeah, The
I don't know it,
Motivational
but I have to read
Speaker.
the motivational speaker.
Yes, by SST Tilawan.
Okay. Eh,
And
okay.
my favorite my favorite song, I have many of them, but for now I like Magasco. It's an old song, but I still like it. Sokoto.
Right, really? Okay.
Yeah.
I see this is like of all my guests, three people have said they like Magasco. Sorry, I get the name right.
Yeah.
Magasco. And so it's music a lot of people listen to then in Cameroon, which is amazing. That's good. Yeah, so
Yeah.
that's your favorite song. But do you find time to exercise as well?
Yes, I do find time to exercise, but the exercise which I do, which is more comfortable for me, is walking. So walking is what I find more comfortable for me. And from time to time, I try to dance, even though I'm a horrible dancer, but I try to dance from time to time.
You try to dance to relax a little bit from time to time. What about sleep? Do you get enough? So that was a Nemo than quote non-habit. That's what I got from Wikipedia. I hope that's correct. It's a legal term, which means you cannot give what you don't have, right? So I heard it twice today. I
Okay.
just thought to share it with the
Name of that
viewers.
quote
And
non
what about,
habit.
yeah,
Okay.
Nemo quote non-habit. That's it, right? Yeah. So you can't give what you don't have. That is exactly the Wikipedia
Exactly.
version. I actually used to think it was Nemo quote not habit, but if there is a dot in the middle, okay, fine. So do you find time to sleep, to get enough sleep daily?
Yes, yes. I don't joke with my sleep. I get enough sleep when I have to sleep.
Great. So now I would like you to say hello to someone out there watching, someone you want to greet, anybody you want to say hello to.
My hello actually goes to all the health professionals out there who are giving in their best to ensure that people suffering from the coronavirus are getting healthy or getting better. People who are putting their lives at risk to make the lives of others better. I'm saying hello to you all, and may God bless you abundantly in all that you're doing.
Great. And before we wrap up, I'll also give you a chance. You've said hello to some people, and you had mentioned your family at the beginning who will watch this later on. You already said hello to them at the beginning. I'll give you a chance now, since the world is going through an unprecedented situation. It's something which is not comfortable for the world at the moment. But then we give a chance for our guests to address the viewers, address the world basically at this time when the world is undergoing a pandemic and the statistics indicate the numbers keep rising. And as of now, we don't know if we've hit the peak yet. Because if we hit the peak, then we understand we start going down. So while some people have lost their lives, some are fearing for their lives, we have to be in a lockdown. Just take the next 3 minutes and maybe pass on a special message from your heart to the world.
I'm going to tell everyone that this challenge we are going through, it's not the end of the world. we might be feeling like we are stuck where we are, like maybe it's the end of everything, or we are just not existing anymore. But I want to let everyone to know that it's not the end. There is hope, and hope is what keeps us going. Let's keep praying to God. Let's keep crossing our fingers and waiting that all of this is going to be over. Let us keep nurturing our dreams. Let's not forget about the dreams that we had. We keep nurturing our dreams and working towards those dreams. Even if we are in the house, let us keep working on those things which we believe in, and know that tomorrow it's going to be a better day. Maybe there is time for everything. There is a season for everything. There is a season for rain and there's a season for rain. So there is time for sadness and there is time for joy. This crisis, like every other thing, it will come to pass, and then we are going to go back to our normal lives and be free again.
Great, great. So there's a season for everything, ladies and gentlemen. You've heard that. That was the young and brilliant Tanekeu Durance, like I always say. Go back to watch this video from the beginning again. She's shared with us a lot of things which are good and very positive to look at when we're encouraging the young to get into entrepreneurship. We want to thank everyone who tunes in every evening at 7 p.m. German time, 6 p.m. Cameroon time, to be able to share with us, exchange with us. We're able to travel across the world just from our homes by running these interviews. So I want to thank you so much for joining us in this interview, Durance.
Oh, thank you so much for having me, Miranda. It's been a pleasure, and I've really had good time with you this evening. Thank you so much.
Right. So we want to congratulate you once more for winning the cash prize, the Returnees Young Entrepreneur Cash Prize last year. That's what got us to meeting you and your work, always putting yourself out there. Keep doing that. Right? Keep shining the light for others to see and follow. So we wish you a very lovely evening. Accept greetings from my family as well. You saw my little boy already the other day when we're running the test session, right?
Oh, yeah.
Yeah.
Thank you so much, Miranda.
My pleasure. Enjoy the time with your family. Make the most of the time with your family. Family is gold. Family is everything. So I am looking for Sokoto, since you say it's your favorite song. So
Oh,
we can
yeah.
interview with them. And thank you so much to the amazing Chinese team for all you're doing. Let's find a
Thank
favorite
you.
song. Let's
Oh, wow. So good.
Then we don't any pass, baby. Oh, I love you, make you know what, baby. Oh, if I give you better than me, my God, so give me that bum bum, give me that bum bum, give me that bum 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 bum, give me that bum 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 bum, give me that bum bum, give me that bum bum, give me that bum 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 bum, give me that bum 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 bum, give me that.
All right, ladies and
Thank you so much, Miranda. And thank you to everyone who followed us live. Thank you, everyone. Thank you so much for all the messages that you've sent. I'm really grateful. And it's your feedback that keeps us going. Truly, I'm grateful. Thank you very much. Thank you all, Felix. and seeing your message. Thank you very much. Thank you all. I'm so grateful.
Thank you, Diaspora watching. Get in touch with Durance of the Quality Healthcare Clinic in Cameroon. It's only through initiatives like this that we can build the country. You can't wait for the government to do everything. If there is someone out there who is doing great, reach out your hand, hold their hand, pull them up, touch their lives so that they can in turn touch other lives. So the Quality Healthcare Clinic in Cameroon, in Yaoundé, is waiting to get more, contact from you, from the diaspora. Help us to help the nation. Help us to build together. My name is Miranda OBEN, as you already know, and I'll see you tomorrow, 7 p.m. German time, 6 p.m. Cameroon time, when we talk to Pam Happy. That's Miss P of the Miss P Show. Wow. And the rest of the week, we have brilliant guests lined up. Stay tuned, and thank you for tuning in. Durance, thank you so much. Great. So have a lovely evening. Thank you all for tuning in, and see you at 7 p.m. tomorrow, right? See you 7 p.m. tomorrow. Thank you to my amazing team for the great job behind the scenes. You're all doing wonderful. Thank you for the energy you send out to us. And I want to thank everybody who tuned in as well, to make sure that we have a good time together, because if it's just us without you, we won't have as much fun as now. Thank you so much, Divine, for all you do. Thank you for being also a great voice behind the scenes for our entire work. The interview you found interesting, and thank you for tuning in. I'll see you tomorrow, 7 p.m. Germany, 6 p.m. Cameroon. Well, of course, Miranda, as you already know. Have a beautiful evening, and bye for now.